Good afternoon, everyone. It's 12 o'clock Nigerian time. How are you doing wherever it is that you are joining us from? We're excited to have you join us on this episode of the Yaba Voice webinar. And today, what we are trying to do, or what we would attempt to do, is to break the culture of silence when it comes to mental health. What we are doing today is to give people the voice and the courage to come out and talk about the mental health challenges openly. What we're trying to do today is to educate people to understand that even with this disability, we can still find strength and move on. And then we want to talk about the myths and quite a lot of things. But before I run on, the medical director and the arrowhead of the Yaba Voice is here. So welcome the formally to this webinar. Over to you, Dr. Adekile Olubenga Owoye.
Thank you very much, Dr. Akintoyese. I really appreciate you for the good work and for keeping this program going. Are we together?
Yes, sir. We can hear you loud and clear.
Good, good. Good afternoon, everyone from Nigeria. I warmly welcome you to this month edition of Yaba Voice. As we all know, Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is stigma and mental health, changing the narratives. Stigma and mental health, changing the narratives. Mental health stigma, which are just the negative attitudes and beliefs surrounding mental illness, create a lot of barriers to care and well-being of our patients. It can lead to discrimination against them. It can result in isolation and reduce opportunity for those affected, hindering their recovery and eventual integration into the community. In today's webinars, there are many questions to be addressed. For instance, what do we understand by mental health? What do we understand by mental illness? And what is mental health stigma? How does stigma manifest in mental health? What is the relationship between stigma and mental health? And how do we mitigate stigma in mental health? To address these issues today, our great mental health experts on the platform. Our first presenter today is Dr. Yetunde Animola. Dr. Animola is a consultant psychiatrist and a mental health expert with over 10 years experience at Federal Neuropsychiatric Hospital, Yaba, Lagos, Nigeria. In addition to her clinical duties, she is actively involved in mental health advocacy and education. She has inspired many as a guest speaker on various platforms, addressing topics related to drug addiction and mental health challenges. Dr. Animola earned a Bachelor of Medicine and Bachelor of Surgery from the prestigious University of Ibadan. She is also a fellow of the National Postgraduate Medical College of Nigeria. In year 2023, Dr. Animola completed a dissertation titled Social Support and its Relationship with Quality of Life, a comparative study of patients with schizophrenia and those with major depressive disorder in this hospital. This research reflects our commitment to understanding and enhancing the quality of life for individuals with mental health conditions. Beyond our medical and mental health advocacy roles, Dr. Animola holds a leadership position as a deaconess in our church, and she's happily married with children. Our second presenter today is Mrs. Oke Mavis Oluwatoyin, who is currently an assistant director of nursing at this hospital. She is a compassionate and skilled mental health nurse with about 23 years of experience in psychiatric care, crisis intervention, and patient advocacy. She's dedicated to providing holistic, patient-centered support to individuals experiencing mental health challenges, fostering resilience and recovery. She's passionate about mental health awareness and community outreach, and she's actively participating in mental health educational programs. Mrs. Oke Martins is a registered nurse, a registered midwife, and a registered mental health nurse. She also holds, in addition, Bachelor of Science in Nursing Science, as well as certificate in leadership and management in health. Our professional affiliation include the following. She's a member of National Association of Nigerian Nurses and Midwifery, also a member of International Society of Substance Use Professionals, also, and a co-opt committee member of Mandatory Continued Professional Development Program for Nurses in Lagos chapter. Ladies and gentlemen on the platform, I want us to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, to Dr. Kemi Akitoyese, in anchoring this program.
Thank you so very much, the medical director. The medical director had also created this ambience so also would allow us to dive into the discussion for today. And you know, one thing I would also always love about the medical director is it does not just give information, it gives you very correct information that creates that hunger for you to want to learn more and to know more. And so he had introduced our speakers, and they would be sharing from their world of experience on this topic today on stigma and mental health. We're changing the narrative, giving voice to people to talk about it. And Dr. Animola is going to kickstart this conversation by sharing with us mental health, or are we talking about mental illness? And then this issue of stigma, what is it exactly? And what are those myths or misconceptions about mental health? Over to you, Dr. Animola. Dr. Animola? You're still muted. Okay, so while we're waiting for Dr. Animola to, all right, you're on now. You can go ahead, please.
Thank you very much, Dr.
Okay, yes.
Good. I also like to thank my medical director, Dr. Olugbenga Oweye, for this great privilege to be on this platform today. Today, we are discussing about stigma and mental health. Mental health has long been surrounded by stigma, and this prevents many people from seeking help. It also prevents many people from expressing their struggles or even discussing their experiences openly. This stigma associated with mental health is rooted in ignorance, which is one of the main reasons why we are having this webinar today. Stigma is also rooted in fear, cultural attitudes, and it creates a cycle of silence and discrimination. The term stigma refers to the negative beliefs and negative attitudes associated with mental health conditions. Stigma can manifest in several ways. It can manifest in the form of social stigma, self-stigma, and institutional stigma. The impact of stigma is profound, especially for these individuals with mental health conditions. It discourages them from seeking help in a mental health institution. Stigma also isolates them from the society and reinforces some harmful misconceptions about mental illness. Some common misconceptions about mental illness that could contribute to stigma include the fact that some people are of the opinion that mental illness is caused by spiritual attack. Mental illness is caused by supernatural power and is as a result of a curse or possession by evil spirits. Some other people are of the opinion that mental illness is unusual, that mental illness are not real medical conditions. Other misconceptions about mental illness that could lead to stigma is the fact that people believe that mental illness individuals are dangerous and violent. Mental illness is something to be ashamed of. People with mental illness cannot work or cannot be successful even if they work. Mental illness is not treatable. It is not curable. Some people are of the opinion that once you have a mental illness, you will never recover. Or once you have a mental illness, people with mental illness can never live a normal life or even productive life. Mental illness is a sign of personal weakness. Mental health treatments are just about medications, and these medications make these individuals to be dull, to be drowsy, and even dependent. Other misconception is the fact that the therapy that is given to these individuals with mental illness is only for crazy people. However, this webinar today is about changing the narratives that is associated with stigma related with mental health. Some people that believe that mental illness is as a result of spiritual attack, we are here to let you know that mental illness is not as a result of spiritual attack. Rather, mental illness results from a combination of factors such as genetic factor and environmental factor. It results from a complex interaction of biological factors, psychological factors, and social factors, and it does not result from possession by evil spirits. Those that are of the opinion that mental illness is unusual or mental illness is not a real medical condition, that is a misconception. Mental illness are very common. Mental illness such as depression, anxiety, and schizophrenia, they are common mental disorders. So mental illness are quite common, and their mental illness is not unusual. People with mental illness are dangerous and violent. The reality is that most individuals with mental health conditions are not violent, and they are more likely to be victims rather than perpetrators. And in cases where violence does occur, the incidents typically result from excessive use of alcohol or other hard drugs, or even some of them might be threatened or provoked by other individuals. So mental illness is not as a result of dangerous or violence. Mental illness is something to be ashamed of. No, mental illness is not something to be ashamed of, because it is these family members, the family members and the friends of these individuals, that always make them to feel ashamed about the illness. For those that are of the opinion that mental illness is not curable or mental illness is not treatable, people object to this. Mental illness is actually curable. Once they present in the hospital or in mental health institution, this illness is curable just like physical health. Thank you very much. Over to you, Dr. Akintoye.
Thank you so very much, Dr. Animola. And Dr. Animola had started with us by giving us an insight into what mental health is, what are the stigmas, the common belief, the mental set that we hold on to. Now, this mental set could either be religious, cultural, or social, but they are very prevalent in our environment. And a lot of time, they prevent a lot of people from either seeking help, recognizing that they are actually healed and they need help, and then they need to be able to get out of it. And now, Mrs. Marvins will be telling us how societal norms and expectations contribute to the stigma surrounding mental illness? Over to you, Mrs. Marvins.
Good afternoon. Thank you so much, Dr. Thank you so much, Medical Director, for this great opportunity to be on this platform. Like Dr. Animola had rightly explained, the stigma, the conception, and the myth that surrounds mental illness that makes us to discriminate those who are mentally disordered. This all leads to stigma. We can see that the society expects too much from individuals. And when an individual could not conform with the societal expectation, they are termed to have derailed. Societal norms and expectations play a major role in shaping the stigma surrounding mental illness. There is pressure to conform. The society expects individuals to be emotionally strong, self-reliance, and even to be in control of situation. When there are signs of mental illness and the individual could not conform to what the society expected, their time has been weak, unstable. Why? They could not fit into the normal mode. Because, and all this are due to lack of understanding, and that's why we are here, to create an awareness. There's lack of understanding of what mental health issues are. And when there are misunderstanding, the society treats the individual as whole, as a weakling. And this more prevents those who are mentally, healed to do what? To seek for support, to seek for help. They may treat mental illness as a personal failure, character flaw, rather than seeing it as what? As a medical condition. Whereas, as we have been told by the first speaker, mental illness is not spiritual. It is a medical condition. So we should see it as a medical challenge, health problem. Cultural beliefs. This cultural belief, they attach it to, once the moon is out, you see that they start misbehaving. And that's why they call them lunatics. And it is not like that. And all these beliefs and expectations make an individual to do what? Find it difficult, even to do what? To express their symptoms and their pain. The consequence is that people fear losing their job, being judged by peers, by family, by co-workers, by the community. And for this, they find it difficult to do what? To seek for medical assistance. These real or perceived consequences make it more likely for people to do what? To suffer in silence. Makes people suffer in silence. In short, societal norms create a framework for what is considered acceptable behavior. And when someone deviates from this so-called acceptable behavior due to mental illness, they are marginalized, they are stigmatized. And those who are suffering from this condition tend to isolate themselves because they have already been isolated from the community due to fear of being misunderstood and being misjudged, being segregated, and being rendered redundant. And because of this, sometimes it gets to a level that individuals suffering from this condition do what? Stigmatize themselves. That is what is called internalized stigma, because they believe they are not acceptable by the society, even when they have been medically ascertained fit to go back to their duties. Therefore, the expectations and the norms that is attached to this mental health, mental illness, always, affect people going through disorder, and deprive them from seeking prompt help. Thank you. Back to you, Ma.
Thank you so very much, ma'am. And you have raised something very germane, and which is the fact that it does not even just affect the society. So the individual who is being stigmatized goes through a lot. The society itself also is affected because this individual withdraws from it. That he's not a part of it. The contributions, the meaningful contributions that this individual should make, he's not able to make it. So we do not benefit from this individual, and that is a whole lot that the society as a whole will have to deal with. And for me, I would say, if you know someone who needs to be here, If they're not able to join the Zoom, please, they can join us on Facebook. We're live streaming live, so they can, they can also be a part of this. Religious leaders, head of organizations and corporations needs to hear this, because a lot of times when people go through these difficulties, mental health diagnosis, you would find out that their work might be taken away. It has a lot of implications. We would get there, but I'm just trying to help you to understand that what we are talking about is huge. And so please get in touch with someone that needs to be here. Let them understand it. We have family members who have kept relatives away for so many years, locked up. We do not want this person to be seen with us. And this individual can be helped. When they are helped, they can come back and become fit, and then they're able to move. So please get them to be a part of this webinar so that we can move together as a society in breaking this culture of silence and help them to be able to move on appropriately. Now, Dr. Animola is going to be sharing with us how stigma affects help-seeking behavior and then the treatment outcome for individuals with mental health conditions. Over to you, Dr. Animola.
Thank you, Dr. Akintoye. Stigma has a powerful and often damaging impact on help-seeking behavior and treatment outcomes, especially for these individuals with mental health conditions. Stigma could lead to delayed help-seeking for these individuals, or even it could lead to avoided help-seeking. These individuals, because of the fear of negative judgments by people around them, because of the fear of being labeled as crazy individuals, weak individuals, or unstable. Some might even label them as schizophrenic individuals. Because of this fear of negative judgments, they might delay their help seeking or even avoid help seeking. So that is one of the effects of stigma for these individuals. It could also lead to reduced access to care, because discrimination in healthcare by some healthcare individuals reports that show that it could lead to reduced access to care for these individuals. Stigma could also affect their treatment outcome by leading to poorer treatment outcome for these individuals. It could also lead to negative impact on social support for these individuals by leading to relationship strain or loss of community identity for these individuals. This stigma can lead to misunderstanding or distancing from families, distancing from friends and even employers because of the stigma that is associated with mental illness. It could also lead, in some cases, these individuals might be rejected by their communities, or they might be rejected by their cultural groups. All these are effects of stigma in help-seeking behavior and even treatment outcome for these individuals. People with mental illness might also drop out of therapy, or they might not take their medications regularly if they feel ashamed about their diagnosis or they feel ashamed about their treatments. We have a lot of them. As they come to see us in the clinic, we realize that they don't take their medication regularly. And when we try to find out from them, why are you not taking your medication regularly? They express to us that they feel ashamed about their diagnosis. They feel ashamed about their treatment. Their family members are making critical comments about them. This is one of the effects of stigma that is affecting their treatment outcome. It could also lead to lower quality of life for this individual. Stigma increases isolation. It increases stress and could lead to low self-esteem for these individuals. This can worsen their symptoms and even reduce their motivation to improve their symptoms. Reluctance to continue treatment is another effect of stigma for individuals with mental illness. Individuals might even stop treatment prematurely due to pressure from the family or pressure from community who view this individual as negative, who label them. And in short, stigma does not just prevent them from seeking help, it can actively worsen the cause of a mental illness by deepening suffering and cutting people off from the care and support that they need. Thank you very much. Over to you, Dr. Akintoye.
Thank you so much. I just noted what you just said, the last part of the last sentence now, and that is the fact that you said worsen the cause. And if you find out in our society, people oftentimes when they are diagnosed with mental health condition, there is that feeling that comes with that, like, oh, now I am mad. Now that's just the natural, that is the natural thing that comes with a lot of people. And they just feel, oh, now I'm mad. Now to carry that on, and then the society now starts either name calling them, or is that start segregating or discriminating against them. That creates a huge pressure. Now, Mrs. Martins is going to tell us how those ways that stigma in itself can lead to isolation, social isolation. We talk about discrimination and marginalization. And let's look at the effect on the individual. What do we see? How does this manifest? Over to you, Mrs. Marvin. Mrs. Marvin?
Oh, thank you very much. Social isolation, discrimination, marginalization, all this can be caused by stigma. Stigma leads to social isolation because the individuals, see themselves as being misunderstood, misjudged. Now tend to withdraw to themselves. Why? Because others does not accept them. They do not accept their symptoms and their conditions. They withdraw. Why? They are excluded from the community, from activities that they even find pleasure in doing. And therefore, because of this, they rather withdraw to themselves due to fear of being misunderstood, fear of being misjudged. And also friends and family, co-workers, most of them are guilty of themselves from these patients, these individuals that are suffering from mental illness. And therefore, the individual sees themselves as being unwanted. Therefore, they withdraw themselves. They feel they are alone in the world. So they get disconnected. They isolate themselves. Discrimination in workplace, people with mental illness are always being passed over for promotion. They are being denied their jobs, even the best thing they could do, the skillful things they could do. But because they have been once diagnosed and people have misunderstood them because of their symptoms during the illness, they do what? They sideline them. They render them redundant. And this goes on. And the individuals see themselves as hopeless. As hopeless. They are being denied jobs. Sometimes they are even being fired. They are being laid off. In legal ads or education system, we say that they may not even receive fair treatment or access to necessary resources. They have already been stigmatized. They have been tagged. Hence, mentally ill people are always being pushed aside. They are being pushed to the edge of the society where they are less likely to receive support, respect, or inclusion. They are being marginalized. They may be labeled, or they are even labeled dangerous. Like our first speaker said, they are always being labeled dangerous, unreliable, and this makes it very difficult for them to participate in community life. Find it very difficult to participate in community life. Stigma doesn't just affect how others treat those with mental illness. It also affects how individuals see themselves, limiting their opportunities and quality of life. This also does what? Limits their life, the quality of life they lived. Therefore, we should stop this stigma so that they can live a fulfilled life. Over to you, Dr.
Thank you so very much, Mrs. Marvins. I know what I heard Mrs. Marvins talk about so much when we are looking at social isolation, discrimination, and marginalization is until we have a culture of acceptance, then we cannot deal with this thing. It's the culture of acceptance. It doesn't matter what you are labeled with. It doesn't matter what the diagnosis is. We must begin to accept them for who they are. they are still unique. They're still this individual. It's just that a part of their body has a dysfunction at that particular point in time. But they are still an individual, and so we must treat them as one. Otherwise, it would affect not just the society, it would affect their own functioning. So an individual who may have the capability to be able to get up and run will not be able to do that because we have labeled them and we have told them that they cannot stand up again. And that's why Dr. Animola will be talking to us about the strategies or initiatives that we can effectively deploy to now begin to reduce stigma in such a way that we are able to promote mental health awareness. Over to you, Dr. Animola.
Thank you very much, Dr. Akinsoyeshi. There are several effective strategies and initiatives that have been implemented around the world to reduce stigma and promote mental health awareness. Some of these strategies that have been part of is mental health education on different platforms, starting with this platform, the Yaba Voice, which is the social media platform of the Federal Neuropsychiatric Hospital, Yaba, Lagos, to create mental health awareness. Other platform is school-based programs. These school-based programs helps in educating students early about mental health, emotional intelligence, and stigma. And this help to reduce stigma and promote mental health awareness. Then we have workplace training. More institutions are offering mental health awareness training and employee assistance program. This helps to foster a culture of openness and support for their workers. Then we have peer support groups. These support groups led by people who have experienced mental illness themselves. Examples are support groups like Alcoholics Anonymous, which is very much available in our community. Then we have mental health advocates and storytelling platforms. Projects like the Mighty or Woman of New York, which feature many mental health stories and help to humanize mental illness and help others relate and empathize with these individuals with mental illness. Other strategies and initiatives include policy and legal reforms. The National Mental Health Act that was recently released January 2023 is one of the policies that talk about the rights of individuals with mental health conditions. It highlighted the rights of these individuals and helped to reduce stigma for these individuals. Then others include mental health parity laws and anti-discriminatory laws. The mental health parity laws help to ensure that mental health care is treated equally with physical health care, especially with insurance coverage. The anti-discriminatory law protects individuals from discrimination based on mental health status in work, their mental health status in housing or education. We also have some cultural-based initiatives and community-based initiatives, such as the faith-based programs. We also have localized campaigns in indigenous community or minority communities. Then we have SOPIN, which is another initiative. SOPIN stands for Suicide Research and Prevention Initiative. This helps in preventing suicide and also help to reduce stigma associated with mental illness. We also have some public awareness campaigns that helps to reduce stigma as much as possible. Again, I would like to emphasize that each of these strategies work best when they are sustained over time and involve people with life experiences and are adapted to the cultural and social context of the community. Thank you very much. Over to you, Dr. Akinsoyeshi.
Thank you so very much. Now, it's about sustainability, if we will get it right. That is what I hear Dr. Animola say. And for all of these platforms that she had mentioned about people who had done things in the past, it's more about sustainability over time. The Alcohol Anonymous, I know quite a whole lot of other people like that. It's about sustaining them. And it's also about the voice. Now, Yaba Voice is a platform curated by the Federal Neuropsychiatric Hospital, Yaba, Lagos, to be able to get information right to the general populace so that they can be more aware of mental health. You can also be the voice. Because until we all begin to shout it, talk about it, then nothing is done. Now, I remember some few years back when a woman came she was sent by the ministry to come in and represent the deputy governor. Then we had the program, Depression in Women. And then she came in, I watched part of the team that welcomed her. I said, do you know this is my first time of walking into the psychiatric hospital? And I said, oh, wow. Usually you may not walk in there if you don't have a patient or you don't have a business there. But you know, what was more surprising was the fact that she said each time she was passing in front of the psychiatric hospital, she usually would turn her eyes to the other side so that she does not see the gate. Now, that's how bad it is for some people. They don't want to hear the name. They don't want to even see people who work there. You know, for some people, they would even tell you that people who work in the psychiatric hospital will usually behave like their patients, like the Yorubas will say, I don't know if it is Doshain, but the truth is it. There are a lot of things that we must begin to talk about. Otherwise, most times when I walk into this hospital, I imagine what people who are passing will be thinking, or you driving, whatever, like, it's going into the psychiatric hospital. That mindset is what we are looking at changing. Because if we do not all become the voice, the vanguard to make this change, then we will not be able to achieve what we are talking about today. And Dr. Nimola had mentioned intentionality is key if we will be able to do this and do it effectively well over time. Now, Mrs. Marvin is going to be talking to us about how education and awareness raising effort can help to challenge and change the negative attitude and stereotypes that people have when we're talking about mental health. Over to you, Mrs. Marvins.
Thank you. Education and awareness promotes accurate information about mental health and helps dismantle myths, misconceptions that we have talked about in workplace, right from the schools, secondary school, even down to the primary schools, and our media houses, when they portray mental health and mental illness as not what is dangerous. So education and awareness is a key because it will make us to know that mental illness is an health condition and is treatable. It will make us and the community, the populace, to do what? To commonalize it, unlike when they have given it a big name and tagged it. It also makes individual who is suffering from these mental disorders not to be ashamed to open up. Education and awareness helps individuals to open up, speak freely, and seek help. Words matters. Language matters. When we use respective words, non-judgmental language, like when you are saying person in depression, instead of a crazy person or lunatic, a psycho, when we change our words, it helps to reshape how we think, how we talk, how we act about mental illness. And that is why we are here today, to change our mindset and change our orientation. And positive media representation helps by portraying mental illness accurately and compassionately, being empathy about this on our televisions, in our films and videos, and our news. This challenges stereotypes and offer what? Hope for individuals. And it helps individuals to be able to seek help promptly. Advocacy helps to be able to stand up for those who are going through it. Therefore, we should all come together. One, change our own mindset. And that is why we are telling us today, because education is scientific based. And today we are telling us that mental illness is not spiritual. It is an earth challenge which can be managed and treated. Therefore, we should all come together, change our ways, change the way we act, change the way we speak about it, talk about it freely among our peers, in the community, in our societies that we belong to, in the churches, in our mosque. We should be able to tell others freely and accommodate all their excesses, allow them to express their feelings and offer hope that will lead to a quality life. Thank you. Over to you, ma'am.
Thank you so very much. And this is about us challenging the stereotype. Now, if we do not all rise up to challenge the stereotypes, then we cannot. Now, but it starts with you. Because, like she said, most times in movies, the way they portray madness is just the fact that you are on the referee zone. Now, I'm not saying this doesn't really happen, but do you know that there are lots of mental health challenges also that, they will still wear suit and tie. They wear suit and tie, but they are not able to talk about it. They are not able to get the help that they need because we have not given them that environment that is enabling enough to talk about it. Now, Professor Badru says it is known that stigma is not just one category by many. Thus, strategies to address or deal with such stigma need to be specific. Public stigma, self-stigma, and structural stigma require different narratives and conversation to combat the stigma. It is indubitable that addressing such myths, misconception, prejudice, and discrimination about stigma would definitely positively dovetail into inclusive and therapeutic environment. And I quite agree with you. I so much agree with you because when we're talking about stigma, like we had established when we started this webinar, the fact that it has not just effect on the individual, but it will also have effect on the society as a whole. And it has different structures where it is coming from. When Dr. Animola earlier was talking about the myths, the misconception, sometimes even in our spiritual homes, places, you have people who would say, "Oh, you're strong enough, we'll faith it," and other things like that. And then if you're not able to faith it, you're seen as the weak one, the person who is not able to, you are like breaking the faith and other things like that. And that also makes people to feel quite overwhelmed. They're not able to open up and talk about it. And that's what we are looking at today. And Dr. Animola is going to go on to talk to us about what social media and online platform can do in reducing, because yes, Mrs. Marvins, as earlier talked about, our television houses and other things. What can we do? How can they help us? How can people use their platform to do so much more when we're talking about the issue of stigma? Over to you, ma'am.
Thank you very much, Dr. Akintoye. Social media and online platform plays a significant role in promoting mental health awareness and reducing stigma by amplifying voices and personal stories. Social media platforms like Instagram, TikTok, YouTube, and Twitter allows individuals to share lived experiences with mental health, helping others feel seen and understand. Storytelling reduces stigma by humanizing mental illness and challenging stereotypes. All these help to reduce stigma associated with mental illness. Social media also play an important role by helping to spread awareness quickly. Awareness about mental health awareness, ending the stigma, and Bear Let's Talk can go viral via social media, reaching millions of people and sparkling global conversations. Infographics, short videos, and reels also provide accessible, shareable education on mental health topics. Social media also creates safe and supportive communities for people. Online support groups and forums such as Facebook groups give people a space to connect, to share and feel less alone. These spaces often promote peer support, especially for those who feel isolated and can't access in-person help. Social media also help to access resources and also help to access professional helps, especially in the mental health institutions. Social media can direct users to different therapists, hotlines, apps, and self-help tools. Mental health professionals also use this platform to provide psycho-education for these individuals, breaking down therapy misconceptions and reducing fear surrounding seeking help in mental health institutions. Social media also help to address all challenging, especially challenging harmful narratives. While social media can be empowering, it can also spread misinformation and promote unrealistic expectations or trigger mental distress if not used mindfully. I would like to emphasize at this point that social media is a powerful tool for mental health advocacy. When used responsibly, it can educate, empower, and connect people, breaking down stigma and helping to create a culture of openness and support. Thank you very much. Over to you, Dr. Akintoyeshi.
All right, thank you so very much, Dr. Animola. There was this guy on social media one time like that who shared. I had to I tagged the medical director, and then as well also made a response. And I can't remember what his name was on Instagram, but he had this dance at the gate of the Federal Neuropsychiatric Hospital, and the way he was dancing and making jests and every other thing just goes to show that we are not there in this country. Because when you want people to get help, and then you want them to be able to receive the right support and treatment that they need, then we must make it look okay. Until we make it look very okay, then people will not come. The way he was dancing and doing, and like, hey, they have taken me to, I was like, oh no. Now, usually people would talk about Yaba left. But I've gone to forums and I would say to them that the truth is, when you go to the Yaba right, the supposed Yaba right, it's not as sane as simile as the Yaba left. Because Yaba left, if you come to the Federal Neuropsychiatric Hospital now, the environment is beautiful. The environment is beautiful. You won't see a patient loitering. You won't see a desire. You won't see somebody drawing your clothes. Come and do this. Come and do that. And there is no shout. There is no noise all around. So we must begin to make representations that are good on the social media. So that would encourage people to come out more, people to talk about it, people to share their body, share their pain, walk in, get treatment like they would do at any general hospital or what have you. And that's what we're talking about. So what Dr. Adimola had said, let's make it more acceptable for people to be able to get the help, to talk about it. I loved when she was saying storytelling. I can imagine a day when people would come out and share their story, and we would all rally round and see how we can best help them, give them the support that they need to be able to push through challenges like that. Please remember that if you have questions or comments, you can easily drop them on the chat box. I will be ready to read them before the end of the webinar. Now we're going to Mrs. Marvin's, and she's going to be telling us how to now encourage people to talk about it. Hey, you will go out and tell somebody, excuse me, I've been diagnosed of schizophrenia, or I've been diagnosed of this. I hear people will say, no, keep quiet, don't talk about it at all. So how can we encourage and support individuals to speak openly and honestly about their mental health experiences without fear of judgment or rejection? Over to you, ma'am.
Thank you very much. Yes, all start from awareness creation, and that is starting from going back to our society and our communities and talk freely about mental health. And by the time we start enlightening the community what mental health is, how can we maintain our mental health, what are the factors or predisposing or precipitating factors that can make us, break down mentally or bring about mental disorder. Knowledge is power. By the time we start, sensitizing the community, at the end of the day, you see one or two people coming to you, and the way we go about it as normal norm, talking about it like we are talking about hypertension, we are talking about malaria, and we are creating awareness about other health conditions. Make them know that this is a health condition that can be taken care of, making them still themselves, that even though they have this challenge, they can still live a quality life. Then words matter, like I said, the way we present it to them, the way we talk to them, we accommodate them, we allow them to ventilate their mind. And when they are talking, well, when they are going through some challenges, we don't judge them. We don't judge them. We don't criticize them. We don't affect whatever they are experiencing as a flaw, as a weakness. No. By the time we build our confidence in them, that whatever you are going through, I'm a friend, and I'm ready to go along with you. We are ready to do it together. They build that confidence in us. And with that, they'll be able to speak freely and will be ready to access medical care. Many of us, we held on to these myths and misconceptions. And immediately we see anyone with this mental disorders, we begin to do what? We begin to, stigmatize them. We have to change. And that change starts with you. It starts with me. Right from now, that we change our mindset. When we see them, let's not just look down on them. Let's not just push them aside. We should not even make them feel as if they are not wanted in the society, but rather, let's integrate them back into the society and let's make them see that they are important and that they can overcome it. Through our ways, we build that confidence, and that is why language matters, words matters. Our communication is a key, and with that, they will be able to see it as a challenge, a medical challenge that has a solution. And instead of isolating themselves, locking themselves up on the three boomerang, they'll be able to come out boldly, talk about it. And even we encourage those who have gone through this experience and are doing well to be able to do what? Sensitize others to believe with that. We'll be able to achieve this. And they'll be able to see themselves. I've had experience of people during seminars like this, during awareness creations, and after the program, they will come and meet you privately and they begin to tell you what they have been going through. What can I do to overcome it? I've been like this. Be able to provide solution to them. So I believe we can all do this together by changing the way we see them, the way we react to them, and bringing them to ourselves, accommodating them, making them see it is a health condition that is treatable. Over to you,
Thank
man.
you. Thank you so very much. I love the fact that you said the words we use. Words are powerful. Words can lift, words can destroy, words can damage. And so we must be able to find the right words. If you do not understand what this individual is going through or what their experiences are, then please refer them appropriately. And that's why we have our center, the firmest and the best, in terms of mental health care. To refer them, we will be able to profile them. So if you do not understand what to do, then you can always make referral. You can always ask questions and then help them to be able to navigate their experiences and their challenges. Now, somebody sent a question to me privately, and the question is, Dr. Animola, she's asking that she knows that this family member has mental health challenge, but every other member in the family is saying it is spiritual. What can she do? She said, as a matter of fact, if she says mental, everybody begins to rebuke her in the name of Jesus. So what can she do? How can she help? Over to you, ma'am. Dr. Animola.
Thank you very much, Dr. Akinsoyeshin. For such individual, their person that has that question can help the individual to seek help in mental health institution. She has to help the person to come to the hospital, for the person to come and seek help, because that's the only way we can help to address the mental illness and also treat such individual. Such individual might require outpatient treatment, or the individual might require inpatient treatment. Whatever treatment that such individual needs, it's important to help such individual to seek for help in a mental health institution so that that mental illness can be addressed and treated equally. Thank you very much.
All right, so it's important that you bring this individual. Sometimes it's difficult to convince everyone in the family, but sometimes all that you might just need to do is say, let's try, let's come and listen, fact finding, and then we'll now take decision, like Dr. Animola had said. Now, Mrs. Marvin, somebody is asking and saying this individual has been bashed. The society has not been friendly to this individual based on the fact that there is a mental health diagnosis and is oftentimes withdrawn. Is there a this individual to be able to help them stand up on their feet once again? Over to you, Mrs. Marvis.
Yes, the world might have looked down on you. The world might have said you are nobody, but how do you see yourself? Let's start from there. How do you see yourself? That is, you have to do or come up, boost up your self-esteem. Whatever the world is saying does not make you your mindset. Now, your condition, that was then. Everybody has one health condition or the other that they are battling with. And so don't see yourself as alone, as lonely, as hopeless. We have some cases that are more hopeless than what you are going through. Therefore, brace up yourself and see yourself as a great individual. You're going to pick up your pieces. They are telling you to now be bold and be courageous to stand up for yourself and move on with life.
Thank you so much, Ma. Even in the disability, even in the challenges, you are still an individual. You have something unique that you have to deal with, but doesn't diminish you in any way. It starts with you, first of all. That's what Mrs. Marvin said. How you see yourself, what you tell yourself, the narrative that you peddle to yourself. If you do not start changing the narrative from your own mind, then nobody can help you to change it because you would always go on with what the world is telling you. So, how do you see yourself? And then again, if you find it difficult to be able to just make use of a tip that has been shared here, like I said earlier, we are here to provide you with the necessary help to help you navigate this. The society out there may be very hostile to people who have mental health challenges, but again, we have understanding, we have the training, we have the personnel, and we have the infrastructure to help you. So you could always just walk in, and then we'll be able to provide you with the best help and support that you might need at this particular point in time. And so we'll be taking the last word from our speakers. We do not have so much questions or on the platform today, but there are words of appreciation and thank you from members who had listened to this webinar. Again, also the recorded version will be shared on the Yaba Voice webinar, YouTube page, Yaba Voice FMPHY, one word. You would find the recorded version of this webinar in that part too. All right, so Dr. Animola, your last word, please.
Thank you very much, Dr. Akinsoye. For everyone listening to me, tell someone to tell someone to tell someone that mental health is just as important as physical health. And everyone deserves to be heard, everyone deserves to be supported and treated with compassion. Speaking up about mental health should never be a source of shame, but it should be a sign of courage. Today, I encourage you to start the conversation, whether it's with a friend, a family member, or even a colleague. Together, we can build a community where mental health is accepted, understood, and supported for everyone. Thank you.
Thank you so very much. I love that. I know that's just a very powerful pattern word. Tell someone to tell someone. There's no need to be ashamed. We need to build a community of strength and hope for everyone. I love it. Thank you so very much, Dr. Animola. Mrs. Martin, is over to you.
Ending stigma starts from you and starts from me. Therefore, let's have this empathy so that we'll be able to support those who are going through these challenges. Mental health is health. I want us to have that mindset, and let's all work together to build a culture of support and acceptance, changing how we talk, how we think, and how we act. This will create a society where no one suffers in silence. Thank you.
Thank you so very much. A society where no one suffers in silence. I love that. I love that. So tell someone to tell someone. And by the end of the day, when we are able to tell everybody, we are able to create a society where no one suffers in silence. Now, it's been a good outing today. I want to so very much on behalf of the medical director and all the members of the Yaba Voice team to appreciate our speakers today. Dr. Animola, thank you so very much. Mrs. Marvis, thank you so very much. We appreciate you for being our guest on this month's episode of the Yaba Voice webinar. Thank you so much. It's been wonderful listening to you and drawing from your wealth of knowledge. We appreciate you. We hope you would return to be another on another topic. And on this note, we'll be wrapping up. Please remember that the recorded version and all as well as previous episodes of the Yaba Voice webinar is on the YouTube page, Yaba Voice FMPHY, one word. You would get this recording as well as previous episodes. And we have a lot of topics there, an array of topics. So if you need any bit of information, please add there. And if there's something particular that you want us to talk about, then you could also just send us a message via Facebook, Instagram, or even our Gmail, Yaba Voice FMPHY. That's also the Gmail address. You can reach us, and then we'll be so delighted to respond to you until we come your way in the month of May. And then we'll be looking at developmental issues in children. Please stay safe. And remember that mental health is also as important as physical health. Like we will say it in the mental health world, there is no health without mental health. Please stay safe and take care of yourself. Bye-bye.
Bye.